There we go. All right. All right. So welcome to our allied members to Call Center Connect and to the folks hopping on the line. I'm Leslie Hammond. I work with the Home Care Alliance of Massachusetts. This is one of our lunchtime demos. We're going to hear a little bit about the after hours call answering service that our allied partners Call Center Connect can walk us through how that works for them. And I'll make sure that this recording is available to you and your team, as well as the handouts. Everyone who registered will have it, and we'll also be posting it on our website, which is going over a great big overhaul. I'm excited to share with you guys later this spring. So anyway, take it away, Mary and Andrew.
Okay. Hi, everybody. Thank you for joining on your lunch. Um, this is Andrew, and I am the owner, and Andrew's my director, and we represent Call Center Connect. Um, a little bit about me. I've been in customer service since 1985, and that's all I ever did was customer service, even starting as an agent on the phone. So I understand what it means to take calls and how to do them properly, all the way up to a director until I finally purchased this company, I don't know, 19 years ago. And customer service is what we're passionate about. So we do want to share what we do with you. Um, my motto in our like slogan is we want to be an extension of you, not just your answering service. So we want to represent you just the way you want to be represented during the day. And we are not just after hours. We do take overflow during the day if that's needed. But we're going to go through this little seminar with About Us, our role in technology, our key features and services, our benefits, which is our costs and plans, our success stories, and then our strategy. So that's how we're going to proceed. Let's blow up my screen. There we go. My team, this is my team. So I'm the owner. Darren over here is the billing manager. So she would be the person that would be sending any invoices out. Andrew is the director of operations, and he's been with me for 19 years, ever since I basically purchased the company. And he has lived and breathed everything that we do. Knows our clients inside and out, very responsive. Um, yeah, extremely effective in managing the day-to-day operations, along with Saul and Chris. And there are daytime and nighttime supervisors, so we always have people covered wherever we need them. And Caleb, who is our QA specialist, so he does all the quality monitoring and scoring of the calls that we do every day. So we make sure that the calls are being recorded accurately and they're answering properly. So just a little about us. Every call is an opportunity to make a positive impact. Um, I'm a woman-owned telecommunications company dedicated to serving a diverse range of businesses and industries. While many opt for automation, we stand with the belief that real people deliver a real more meaningful experience. And we do take the accounts very personally. Um, we monitor your calls to assure quality assurance. And if you have any special needs that are not covered by our normal services, we can, provide you a custom package if you need that. But we're really about customer service. We do an off-premise extension of your office, ensuring that every interaction reflects your standards of care and professionalism, which goes back to we're an extension of you. We handle calls with precision and empathy, offering customized solutions such as call buffering, screening, and dispatching, all through our secure HIPAA compliant methods. By catering to your specific needs, we can support the on-call person's lifestyle. So whoever you have on call, we can work with whatever protocols you have. We are obsessed with customer service. So we were created and we are thrive because we believe and we know we can deliver better customer service than what we hear a lot out there. There are really good customer service centers, don't get me wrong. But every time I call somebody, I'm always like, oh, we can't do that, or we can't do this. This isn't what we want to represent. So that's a little bit about us. Oh, we have two main locations, Louisiana and Pennsylvania for national coverage. Our agents are located across the country and they bring their personalities to the team with a beautiful blend of professional and courteous service to all our industries that we service.
So I will take over from here in our role. So as Mary said, we're 24/7, 365, available to you guys all the time, whenever you need us. Customer service, we are obsessed with customer service, like Mary said. That's what we do each and every day. We live and we breathe that. We meet with our agents twice a week, to go over and fine tune their CSR skills. We point out what they're doing well, what they need to work on. And just since the start of this year, we've noticed just that we ramped up our effort. We've always done QA, but we wanted to make it a point to ramp it up this year. And just the results that we're seeing are tremendous, with our agents. They're loving the feedback, and what that translates to for you guys is better calls, and your customers are taken care of when they do call in and they have an issue. Our online access to messages and reports. So for anybody that's interested, we do have a program called IntelliSite, which is like a customer portal for you to access and see everything that we see, or that our agents see on their screen. So it's just, you can go in, you could update on-call schedules, you could update contacts, phone numbers, you could see what messages are sitting there pending. Everything's in real time. So all you need from us is a login, some credentials, and you can get right in and start taking a look around if you were interested in that. Our messages or reporting, we'll touch base on that a little bit later, but we do have custom reporting, which when we did this last month, we got a lot of questions about what type of reports can be sent over, what type of data can be sent over. Things like how many calls did we get for, hospice last night? How many were emergencies? What were routine? And if you're interested in that data, we could provide that to you, in an Excel sheet, a .csv spreadsheet. We could always roll those out to you whenever you needed them. On-call management. Again, if you wanted to do it through our IntelliSite portal, or if you would like us to do that, we certainly can do that for you. If you have a monthly schedule, a quarterly schedule, a yearly schedule, or a weekly one, usually some of our clients will just email those over. They might fax them over. They might just, however they get it to me, we can program them for you. Or if it's something that's constantly changing, or I would suggest the IntelliSite, which is, the patient portal for you guys to go in and make those changes. Accurate and complete messages. This is a thing we're very big on. The last thing anybody wants to do is pay for a service and then you're not getting what you pay for, meaning we're sending you messages in the morning that don't make sense. They're not to the point. Basically, our goal is to just hand off your messages from the night before on a silver platter to give you an accurate representation of what that call was, how it was handled, in terms of what happens from when we saved the call to when it was delivered or relayed to an on-call person, or if it was sent to the office. Our system can track all that stuff. We call it the activity trace. So it'll say how many attempts you've tried to reach somebody, what the agents did, how long it took to dispatch that message out. So that is another feature that we could add to your recaps, where it would give you the message and then all the details underneath, in chronological order. And the last thing here, we are an extension of your office. You know, we hate hearing the term, we're just the service, quote unquote. It's kind of we want to be an asset to your company. We want to work with you. We want to partner with you. We don't just want to be the guys that answer the calls at the end of the day. You know, we want to provide such a level of customer service that we become an asset to your company, like I said. Customizable and personalized service. Our system is customizable to your needs. We build everything to what you need. That's down to when they call in, what do your customers hear when they first call in before they're connected to an agent? What information do you want us to capture on the calls? How would you like those relayed? When would you like those relayed? All of those things, we send over a questionnaire for you guys and you fill that out. And we cater to your needs. It's not the other way around. We adapt to whatever you got going on. So there's some examples of, we have some clients that use a lot of third-party programs and things that we're familiar with. And again, just the amount of knowledge that our agents have and their willingness to learn these new things, all is a representation of our management team and how we want everybody to succeed. So things like Service Titan, Am I On, When I Work, QGenda, Nextech, those are just to name a few. We are familiar if you guys use Tiger Connect for secure messaging. Anything that you want us to access or integrate within you guys, we have network of people that could figure that out if I wasn't able to figure it out. So we can definitely, we never want to say no until it's, absolutely like we can't do that. But our agents are they're so used to getting an account, learning something new and running with it. So and we say if we don't know your software, our staff's willing to learn it. So we would put in the time to teach them, get them acclimated, and get them ready to go for whatever you guys need us to do. Data collection and customized reporting. Over the past 20 years that I've been here and the conversations I've had with people, you'd be surprised to find out how many people don't know this information. They just get, messages every morning and they have no idea what how many calls came through, when they're coming through. This is all vital information that we could provide to you. Now, again, like I said, they could be Excel or CSV format, but the reporting would be through our system. So all the reporting is when the calls reach us, and through our system, we take a message, then we could shoot that information back to you guys. So, how many inbound calls are you getting a day? How many outbound calls are we making? How many messages were taken this past week? How were they dispatched out? How long did it get dispatched out? Another feature we have is our calls are recorded. All of them are recorded, and I can't tell you how many times that these recordings saved us from being blamed for something. A customer or a patient comes in with a story, managers reach out to us, we provide the logger, and there's three sides to every story: the caller's side, our side, and the truth. The tape doesn't lie, as they say. So that's a vital part of the process, and I've helped so many clients over the years being able to provide them with the call loggers. And we do hold those up for 90 days. So you have up to 3 months to, research and get you those recordings if you need them. Now, these are just a few of our dispatching types. So as Mary said earlier, we can do texting, secure texting, pagers, email, fax. We could do them all. If you wanted all of those methods being done for one message, we could shoot those out to you. Now on the left here, this is an example of our secure messaging app, and this is available on the App Store and the Play Store if you have Android phones. This is just an example of how these come through, but the thing I love most about our vendor's secure messaging app is the accountability factor. So when the message leaves our text server and it reaches the recipient's device, once they open that message up, it shoots something back to our activity trace saying user Andrew opened the message or user Andrew viewed the message. So there's accountability on both parts. We can see where it went out and if and when that person that received it actually opened the message. So I love it for the accountability reasons. But also it's super simple. I could send a text to your phone. It's like that. You get it right over there, all the information. You can go in and call the numbers from there, just like any regular text message reviewing, and it's all HIPAA compliant. And what you're seeing down here, as far as what comes over, again, that's all 100% customized to you. If there's something you need with titles and headlines, and let's just say we're asking 100 questions, but you only need 15 of the questions answered or sent back to you on the recap, we customize that for you. To the right here is just a email or fax recap. Again, these are all customizable to you. Now you can see this is when the message came in, when it was saved in the system, and then the agent's initials right here. Tells you the type of call, the caller's name, and again, this is just all things that are formatted for you guys when you need them. So again, the customizable aspect of it is what we like to sell to everybody, because it's like a blank canvas for you guys to, what's going to work for you, what's going to make you guys save time, save some money, like, anything that we could help you out. That's what we want to be there for. All right. Now to the reports, I think this was on here twice. So just again, talking about the reports, things we can send over: inbound calls, outbound calls, patch calls, which are like conference calls. If our agent connects to an on-call person and they say, hey, can you just put that person over to me? That's what we call patched around here. You can find out how long the hold times were. You could find out how long our agents are spending on the calls. Maybe maybe somebody's interested in seeing, why are my calls 5 to 6 minutes a piece, and maybe that's something you could take that information and figure it out. But we have access to all this, and it is available to any of our customers. Average time to answer is another one that shows you how how are our agents doing. We don't want the calls to sit on hold. That's not beneficial for anybody. So that's something that we're constantly monitoring internally for our agents, making sure they're getting to the calls as swift as possible. And then there are custom reports. These are like the generic ones: inbound, outbound, pouch, hold time, average time to answer. But we do have custom reports available if there's something else you were looking for, whether that be like a call type, or how many of this call did I get, how many of that call did I get. That's where the custom reports would come in, and we have ways of documenting that, tracking it, and then getting it over to you. Mayor, did you want to take over from here?
Yeah. Well, the benefits, what we do is we bill by the minute. So what we do is we closely monitor your usage to ensure that you are in the right minute plan. So I have several plans based on minutes of use. It's just like a phone company type of thing. And it's based on operator minutes. And then we make sure you stay in the right plan, because if you take a plan and you're exceeding those minutes, you're going to be billed overages at a higher rate, and we don't want that to happen. So we want to monitor it with you, especially initially when you first come on, to make sure you're in the right plan. And the sales packet, we offer packets to meet your specific needs. Anything that you need, we can adjust to. But what we usually do is we send you the rate plan with all of the minutes. You might not know how many minutes that you really are, going to accumulate. So we usually start at like a mediocre plan and then monitor it throughout the month to make sure that you're in the right spot. And then we can send those out to you, of course, anytime, as long as we have your email. And then we send out the questionnaire on how you would want to, if you're interested in getting the service, all the things that Andrew needs to program the accounts, because he does all the programming. And there's questionnaire could be a little intimidating because it's a little long, but it's important for him to really capture what you need to set up the account exactly the way you want it. So, as a member of the Home Healthcare Alliance, you receive a special discount because we're members. So I think it's on the next screen, Andrew, isn't it? Oh, yeah. So I've talked to Leslie about this, and our setup fee is about $150 because of that big questionnaire that you answer. He has to go in and program that for you. So we're giving you guys a free setup fee and $20 off your first month of service. So that's a little initiative just because we're members and we're proud to be members, and we're happy to be partnering with you guys. So that's our stuff. These are just these are on the website. This is just some testimonials of customers and clients who have liked our service. One of our biggest yay things is how responsive we are. It's not like if you have an issue, a question that you're going into the black hole, you go right to Andrew, or you go right to our supervisor, or right to me. We're not that big of a company. So we really do cater to our clients very, very closely. I think that's one of our biggest compliments that we do get. So
Yeah, we're responsive, we're available. You guys aren't just a number. It's we've gained clients that came from huge call centers and they're like, I wanted more of like a more people to what's the word I'm looking for, Mayor?
more intimate.
Yes, yeah, like a more intimate relationship, not just call and, I'll get a call back whenever. Like if something hits my desk and there's an issue, I'm immediately researching it. I'm immediately replying back with what I found. And over the years, yes, like Mary said, like responsiveness seems to be the key theme in how our clients are loving us, basically. So let me scroll to the next person.
Our mission is to build strong, trusting partnerships with all the members of HCA of Massachusetts by providing a seamless and empathetic answering service. And we're dedicated to customer service, and we do answer with accuracy, professionalism, and empathy. Our 24/7 support frees your staff to focus on your core responsibilities. And as I mentioned earlier, we do have overflow during the day. We are confidentiality is top, and we are HIPAA, and that's top priority. We ensure a timely and compassionate connection between your patients, families, and your team. And we're committed to continuous improvement to meet all of your evolving needs. So we are looking forward to building a long-term relationship, supporting your team in every way possible to help you provide the best quality of care of what you do for a living. And like I said, we don't want to just be your answering service. We want to be an extension of you and handle the calls the way you would do it if it was you answering the phone. So that's our goal. So we're going to the conference. I don't know if anybody's going, but we are going to go and hope to meet some people. So please come meet us at our booth. Look for us. And we have some fun surprises for you. I don't know exactly what they're going to be yet,
Yeah,
but we
yeah.
will have some. And that's April 15th to the 17th. So we're hoping to meet some of you guys.
And you won't be able to miss me. I mean, I'm 7'1", so I mean, you'll be able to spot me out from a crowd.
Great. Yeah, I'll definitely be there. Not 7'1".
You can't miss us. I'm like 5 foot and he's 7'1".
That's great.
And it looks like Mutt and Jeff.
Are there any questions for our
Yeah, I think, yeah, this is our
Mary?
phone number, our website. Um, yes, any questions we can answer for sure. Everybody's
I
good?
do have one quick question. Um, Thank you guys. Colleen and I are both here from the same company. And do you work with other home healthcare agencies in Massachusetts or across the country?
We have some home health care agencies in Louisiana that we answer for. Um, what our role in that company is, they're the nurses are going to the patient's residences, and we get their calls when they're clocking in, checking out, or a patient may call and say, my nurse didn't show up, can you reach somebody? So we triage things like that. We're not necessarily scheduling those nurses and putting them next to patients, but we are familiar with those types of calls and how to handle them. But again, that's all dictated by you. Like, what is it that you needed from us? How can we, use us to your benefit?
Great.
We all also are really compassionate with being empathetic with the callers. Like, if you're dealing with home health care, you're dealing with people who need service. You're dealing with hospice, you're dealing with kind of a crisis situation. So we work with our agents, so they are extremely empathetic and considerate to the calls that are coming in for the sensitivity level that is there. So I just kind of wanted to mention that.
Yeah, and if we, in terms of like reaching somebody, we do, our agents are trained to, and that goes back to the questionnaire of what you want it to be reached for after hours, what you don't want to be reached for, what, the last thing an on-call person wants to do at 2 in the morning is get a call that, isn't going to be handled by somebody until like 7 a.m. So, our clients depend on us based on our protocols to like kind of gatekeep and probe and make sure it's an emergency before we reach anybody. So we're all familiar with that. A lot of the nursing home calls we used to take, our one account, not necessarily home health, but the provider, he goes to different facilities, he sees the patients, we get the calls from the families, checking them in and out, we get the calls from the nurses, and they'll say they're reporting incidents, they're reporting that the patient was sent out to the hospital, and we make the connection there. Or we're just documenting all the incident reports from overnight, or observations from the nurses, and we pass that along in the morning. So again, like something we wouldn't do is like, you know, call somebody in the middle of the night for like something that's super routine, um, and wake them up unnecessarily. Like that's the last thing we want to do. So going back to the questionnaire, if however thorough that's filled out, it helps us and determine and for me to program and basically like anything with that questionnaire, I like to take the thinking off the agent's part. I just want them to follow the form, and based on their selections, all my back end programming will stop those things from happening. Um, oh, don't page me for an appointment at 2 o'clock in the morning. All right, well, I can make it so if they select appointment that there's no way to dispatch that to anybody at that time. So we're looking out for you at the same time. We don't we do this day in and day out. I've been here for 20 years, been through the ringer. I mean, when I first started with the company, I didn't even like ordering pizza on the phone, and now I'm the director of operations for a call center. So,
Mhm.
and that's, a product of Mary believing in me and allowing me to fall flat on my face several times and learn and grow. And she invested in me over the years, and I'm grateful for that. And I enjoy what I do. I love making a difference and helping people, and just my passion for all of that, is infectious throughout our team. We have a lot of compassionate people that care and just want to help people. They're not just there going through the motions. They are trained to hear things, and you know oh, a patient just passed away this morning. Oh my God, I'm so sorry. Let me see what I can do to help you. Not just name, phone number. All right, I'll send it out. Like we don't want to sound like robots. We're people on the other end of the line. Now, in the industry, people are starting to use AI, and Mary and I feel like just there's no substitute for that human interaction, and the conversations and making somebody's day, or assuring them if they're calling in hysterical for something, that we put them at ease and we let them know things are going to be all right, and we're going to be getting in touch with the person to get them the help that they need. So again, that's, what we do every day. So
And I tell you, we have quite a bit of not home healthcare and hospice, but we do have a ton of a lot of medical accounts. So we're very used to people calling in needing certain things and crises and things of that nature. So we are heavy with medical too. Does that answer your question?
Yes, thank you.
Okay, it's a kind of long answer, but
We welcomed Care Connect as a member in Massachusetts just in the last couple of months. So we're excited to see the progress of this partnership over time. They will be available, and I'll send all the contact information to everyone. But that is about 12:30. So if there's no other questions, we will see you in April, if
yeah,
not
looking
before.
forward to it.
Okay.
Are Colleen and Lauren and Barbara, are you going to be there?
At the New England Conference in Portland, Maine.
Yes.
I don't know. I
Uh-huh.
well,
My team isn't, well, myself and Colleen, I don't think we're going to be there, but we'll certainly
somebody.
look into it. I'm sure somebody will be there
Yeah.
from my
All right.
team. Yeah.
Okay.
All right.
Okay,
All right.
okay,
Well, we'll
great.
connect you guys. And I will send the contact information and the recording after it buffers. All right.
Okay, and then we can send some rate packages out
That'd
if
be
you
great.
guys are interested. Yeah.
Thank you very much. All right. You guys take care. Have a wonderful afternoon.
All
Thank
right.
you.
Thank you all for the time.
Bye-bye.
Appreciate it.
Thank you for the time.